Breast cancer. Breast cancer is a cancer that originates from breast tissue. They originate from carcinomas and milk ducts. These symptoms include a ball in their breast, changes of breast size or shape, nipple can sink into the breast, a rash can appear, a ball in an armpit, breast starts to peel and it becomes itching, and there can present metastatic disease.
The treatment of breast cancer begins with its diagnosis. The front line of diagnosis is the self-check for women and men, in which, as previously stated, you check your own body daily, and it is the most important line. However, once symptoms have been detected, other tests exist. Now, the beginning of treatment can take many forms depending on the type of cancer and the patient, including chemotherapy, which is extremely invasive chemicals which stunt cellular reproduction. Then there's also radiotherapy, which literally roasts the offending cells with radiation. There's also a complete surgery where they will cut out the offending cancerous material. And there's even methods where they will remove the entire breast if it is spread too far or the risk of it spreading is too high. This method is somewhat abused by some women who fear they may develop breast cancer, and they will prematurely amputate their mammaries to prevent them from ever developing it. However, this is not a surefire way of preventing cancer, and often it'll just originate somewhere else in their body. Thank you for your time.
What was the first thing that you did for your health?
Once I knew, grab my husband's hand. That's the first thing I did. The second thing I did was to begin to inform myself about what this means, what exactly is it, what the therapy was going to be.
In the end, what treatments were you offered by your doctors that were available?
I was offered 3 things. First was surgery, and it's called a lumpectomy, so they didn't remove the entire breast, they only removed a part of it. So you have the tumor, which was about 1 centimeter wide in diameter, and then they took the flesh around it. So surgery was one treatment. The second treatment was about 5 months of chemotherapy. So every 3 weeks I went in, and it was intravenous. And so I went to Tepic with a chemotherapist oncologist, and they injected the medications. There were 3 different medications that they injected intravenously. And it was every 3 weeks because it's an attack on your system, and so your white blood cells have to work their way up again. The third treatment was radiation therapy. I had 25 sessions in Guadalajara, 5 days a week.
In the beginning, what did you fear most about having breast cancer?
I think I feared the treatment. It just absolutely horrified me. In fact, I tried to talk my doctor into not taking chemotherapy. I kept asking him why, and can't we do something else? I didn't want to have the chemotherapy. I was scared to death of it. Aside from that, obviously, the fear of dying. I started informing myself. I realized that my chances were actually really good, and that you get to live beyond the diagnosis.
And did you ever worry about passing on breast cancer to your descendants?
To my descendants, no. One, because I have a son, and although males can get breast cancer, it's very rare. I don't have any daughters. If I did, I would be concerned about that. My grandmother did die from cancer. She had it very early in life, and then again later in life. But nobody else in my family did, and so it didn't put me at high risk.
And, what was the first sign or indication that made you wonder if you had cancer, or did it show up on the test?
Okay, that's a good question, because no, it didn't show up on the test. That I felt a lump in my skin. And growing up as a woman, you know, since early on, that you have to go to the gynecologist every year and get certain tests done, and eventually as you get older that you should do breast checks and things like that. We took a mammogram, and it showed up negative on the mammogram, which is interesting. And it might just be because of the location. It wasn't in the right place to see it. And then we did an ultrasound, and there it did show up, and we could measure it. 40 is when you start having mammograms. I was 39, so I wasn't having them yet. I don't really think that women need to start earlier. I think 40 is fine. Some people think they should wait until they're 50, and I do not agree, because I know from experience that it can be very real before that. So the more you know your body, the more you know if something's not right.
And what gave you the most hope during the treatment?
Definitely my son. Definitely my son. And we talked about that since the first day, is you can survive this, you have a son, you need to be there. And that was something very strong to fight for.
How did treatment physically affect you?
Good question. Because it affected me backwards, I think. Surgery, obviously, I still get sore where the scar is. They took out my lymph nodes, and so it damaged some nerves, and so I don't have as much feeling underneath my arms. I'm now having trouble with swelling 4 years later, which is kind of weird, but it can happen. So the circulation in my arm is not very good right now. So those are side effects from surgery. From chemotherapy, as you've probably heard about, you have various side effects. My hair did start to fall out, and so my son and husband and I shaved my head and just got rid of it all so that I didn't have to see it falling out every day. That was fine. I survived that as well. I did feel dizzy after each session. Dizzy, nauseated. Although I still worked, but I wasn't very hungry, really. Radiation therapy for me was more traumatic, actually, than the other two, because you go into this room and it's this gigantic machine that is putting radiation into your body, and you know that radiation is bad, and so you're praying to God that they don't miss and accidentally hit your heart. I mean, seriously. It was very traumatic, and it was also traumatic because it was the first time I was in the waiting room with other cancer patients.
How long does it take for you to get over
Cancer?
You personally?
Having cancer or getting over the side effects, or what do you mean?
Both.
I don't think you do get over having cancer. I've decided not to. I mean, I know people who refuse to talk about it, and they've gone on in life. I'm not one of those. I've embraced it and said I had it, but it's not who I am. It did not possess me. It interrupted my life. I am aware that I am at higher risk for getting ill again. It could come back, and I'm ready for that somehow. But in the meantime, I'm just enjoying every day. I'm a much more compassionate person because I had cancer. And so I can reach out to others, and I know how they feel, and I know where they've been. And so I feel like I'm so much more useful to other people now than I was before.
Is there anything else you'd like to tell the class or group or whoever may see this video, this interview maybe?
I think I would say, learn about cancer. You will have someone in your life that will have cancer someday. And so it's good to be informed. Don't be afraid of it. It's not a lovely thing, it is scary, but it is doable, I guess. It's totally doable.
Thank you for your time.
You're welcome.
Thank you.